My intention today is to speak really frankly about emotions in the context of a kidney cancer diagnosis, share from my personal experience, and invite time for a brief practice at the end. So this is our brief agenda for our time together today. There's so many things we could spend time on when we think about this topic, and we are limited, but we're gonna brush the surface here today and hopefully leave you with some really good tools that you can put in your back pocket today and put in your toolbox. We are going to first define emotions, and then I want to spend some time naming the experience of cancer, how distress is measured in our cancer clinics. But again, mostly spend some time hopefully leaving you with some very specific things you can begin using today. I want to say right off the bat that it's really important not to ignore that there are very real barriers to people seeking emotional support during the time of cancer treatment. So we'll talk about that as well in those barriers. So how do we define emotions? It's something we all have, but rarely do we try to name what they are. What are they? So I would argue that emotions are as integral to the human experience as breathing. They are always with us. They help us communicate, make decisions, and understand our environment and the world around us. Some emotions are going to feel good, while others are going to feel not so good. They usually correspond to a physical reaction in our body. When I say the word joy, I want you to notice how your body responds. And when I say the word sorrow, notice if your body slumps just slightly, or if you get a very specific visual in your mind of what those emotions look like. My point here is that these emotions are so ingrained in us. They are muscle memory. Emotions, of course, are also specific to the individual and how we interpret the world around us. So they're very subjective. Someone might feel excitement at the idea of a roller coaster, while another person like me would feel fear and anxiety. So my point with that slide was really to establish that emotions are not a bad thing. Emotions themselves are not necessarily a bad thing. We know that we experience emotions on a very wide spectrum, and let's assume that there is going to be a very wide range of emotional responses that people will have to various events in their life, including to cancer. So before we go there, I want to think about all of the normal everyday ups and downs that we experience as human beings. Then let's just imagine that something doesn't go to plan on any given day. We're driving to work and our car's engine light comes on. Our kid gets called home from daycare for being sick. Maybe you forget your wallet at home and you didn't pack your lunch that day. So we're used to being surprised by inconvenient situations that can interrupt the flow of our days. These disruptions have an impact on how we feel, on our emotions. And to put it frankly, sometimes we lose our marbles when these things happen. When we practice having emotional regulation or resilience of our emotions, we become able to bounce back from these situations without too much long-lasting impact. Maybe we're a little annoyed or we can vent about it later, but we move on. So as we think about discussing emotions when we are diagnosed with cancer, I want to name and emphasize that all of these day-to-day things don't just end when cancer happens, they compound. When we begin to manage how we feel about our diagnosis, we also continue to manage these normal everyday ups and downs that we were already experiencing as human beings out in the world. We continue to be parents, children, partners, employees, the list goes on. And then many times we bring already complicated family or personal situations to the table when cancer enters our lives. So I'm pulling up a list here of common emotions that you might expect to feel with a new cancer diagnosis. And I've put here some very common emotions that you might expect to feel. Shock and disbelief. How did this happen? Uncertainty about the future, both the immediate future, like will I be able to go to work tomorrow, and the long-term future, like will I be able to have children? We might feel regret. We might feel guilt. We might feel something like, I knew I should have been seen sooner. We might feel frustration or anger, sadness, depression, grief, and we begin to cope with the new normal or the new now. Past trauma in our lives can resurface. And then, of course, we're going to have emotions around the practical needs. Financial and logistical concerns have a real impact on our mood. How can I keep working? How do I tell my kids? How am I going to afford this? While it's not exactly our focus today, you'll see on the right side that I also have named some more affirmative emotions. It may be possible that some of the emotions that come up for us are not necessarily going to be a negative. It may even lean towards the other side. We might feel hope. We might feel determination. We might feel grateful. We might feel grateful for our care team, our friends, our family support system. We might feel like we're finding meaning in this. We might feel determined. And of course, I really want to name that it's important to remember that we can actually feel emotions that seem to contradict each other. We can feel two things at the same time that are opposites. We might feel hopeful and we might be in shock. We might feel really angry and we might also still feel determined. Let's talk affirmations. I want to pause for a moment since I mentioned this note about some positive emotions we might have or positive thoughts. I want to be very clear here. So let's not confuse these positive emotions for toxic positivity. Toxic positivity could be defined as putting out an overly optimistic view of things, which could invalidate our genuine feelings of pain, fear, or sadness. And while it can be a good practice to engage in affirmative statements, I've put some up here as possible suggestions. Please know that having a negative thought or emotion about your cancer experience is not going to impact your outcome. However, dwelling on a negative thought might just impact your mood on a given day. You do not need to just stay positive, which is why I put a big strike through the title of this slide. So I'm not going to spend too much time on this slide, but what you will probably have experienced at some point in your cancer clinic is receiving a distress thermometer to measure kind of what's happening in your personal and emotional life at the time of your diagnosis. These are one of the first gateways to support during your cancer journey. Hopefully, if you do answer this honestly, you do have concerns that you name, you'll be connected with a social worker, a nurse navigator, a care manager, someone on your care team to help talk through some of these things and give you resources. I do really encourage you to be as honest as you can on these so that your care team can help you. And if a resource doesn't exist that you would benefit from, this will actually help them develop new programs and prioritize resources for the future. But again, like I said, I really wanted to spend the most time today giving you some real tools to put in your toolbox now. So let's say that we are dealing with difficult emotions and some level of distress. This is expected. What can I do right now to feel better? So I'm going to name and go through a couple of the things on this list, but we're not going to get to all of it today. So feel free to take a screenshot of this list and on your own time, do a little Google search engine tonight when you're sitting on the couch, and feel free to just read up a little bit on some of these skills. A lot of these skills on this slide are actually DBT skills, which stands for dialectical behavioral therapy. And these are skills that help us to tolerate distressing events, regulate our emotions, and really just de-escalate really intense moments in our lives quickly using very specific and concrete tools. So the very first thing on here is actually not a skill so much as a theory. Many of you might know about this spoon theory, and I just want to remind you of it as we're thinking about our emotions. The spoon theory is the idea that most people start the day with an unlimited amount of energy and possibilities, or unlimited spoons. But people with a serious illness usually start the day with only a certain number of spoons that they have to give away throughout the day. You take a shower, that's one spoon. You go to the post office, that's another spoon. And when we start to have a mood concern like sadness, depression, anxiety, these emotions just kind of cost us more spoons. It might mean we have less spoons to start with at the start of the day. And I wanted to bring this theory to the table today, actually, because I'm working with a wonderful client right now who reminded me of it recently. And I went, aha, yes. we need to recognize that our small, manageable goals to improve our mood are going to be the most effective. We have to be really realistic about the spoons we have to give away. Grand promises to ourselves that we are going to journal every day, meditate 30 minutes a day, go to the gym, 10 days a week may just not be realistic to feeling better. So you may not even be able to do certain community outings without your doctor's clearance. So I really want you to be gentle with yourself here. Ask yourself, how many spoons do you have to give on any given day? And be very careful how you give them or to what energy you give them away to. So moving on from the spoon theory, again, great information out there on the internet. Feel free to do a little Google dive. Improve the moment is the next skill here I have listed. Improve the moment is both what it sounds like, but it's also an acronym. Improve stands for I is imagery, M is meaning, creating meaning. P stands for prayer or mantra. R in improve stands for relaxing, doing relaxing activities. O in improve stands for doing one thing at a time, one thing in the moment. V in improve stands for vacation, taking a little mini vacation. And E in improve stands for encouragement. So improve, again, it's an acronym in and of itself for some things you can think to do to improve your mood, to improve and reduce distress temporarily. The V in improve, by the way, when I say vacation, I don't mean book a trip to Europe. I mean, take a mini vacation. Go to a park nearby with a picnic basket and something that you really enjoy. Get away from the house. Do something nice for yourself. Try to figure out, like, what is something small I could do to take a vacation from what's happening. Again, please feel free to take a screenshot of this list and do a deeper dive. I'm going to skip to a few other slides here, but I do want to name on the last point here on this slide is something called your third place. And this is actually another skill that a client reminded me of recently, which I think is really beautiful. They reminded me that everybody needs a third place. They need a place that isn't work. They need a place that isn't home. And I'm actually going to suggest that maybe we all need a fourth place. We need a place that isn't our cancer clinic. So finding out what that third or fourth place is for you. Is it an art studio? Is it a coffee shop you love? Is it a bookstore, a garden center? Where is that place that makes you feel really refreshed at the end of your time there? So the circle of control is a great skill to keep in your back pocket. It's a radically simple concept that can ground us in the moment when things are starting to feel too big, too out of control, and maybe we begin to spiral. You can sit down and simply ask yourself, what are the things in my control today? What do I actually have power over? And again, this control circle is going to look a little different for each person. Wise Mind is a DBT skill where we really want to invite us to tap into our wise mind, to the wisdom that lives in each of us. There's a question you can ask yourself when you're starting to notice you might be feeling some very intense emotions, and maybe you're reacting to those intense emotions poorly. You can ask yourself, am I acting from wise mind here? Sometimes asking the question itself can help bring you back to a state of balance. It's a gentle reminder to come back to that middle place. We all have reasonable mind for a reason and our emotion mind for a reason. They serve really important purposes. But that middle place, that wise mind, is where we have all of that collective experience and wisdom that we can make really good decisions from. The please skill is another skill in dialectical behavioral therapy. It is also an acronym. You can see here, these are really just a reminder of meeting our core basic needs. Feel free, again, this is a great one to take a screenshot, a snapshot of here. We really want to be remembering our core basic needs. And if we can find a way to meet most of our core basic needs, we will have more protective factors to manage the change in our mood and our emotions. So those were some skills specifically about what I can do right now. Let's talk about long-term support planning. Once we've de-escalated our current level of distress, we want to start to think about how we build resilience for the future. Coping in the long term might look like therapy, joining support groups, finding a peer mentor. There are many wonderful, reputable peer mentor programs out there. Asking your cancer center if they offer integrative services, things like massage or Reiki, yoga, acupuncture. If you have a spiritual identity, you want to make time for this. Um, and, you know, when it comes to therapy, jumping back up to that first point, I just want to point out again that it can be hard to find a therapist that takes your health insurance coverage, that has availability, maybe that you have a real rapport with. So if therapy is something you're thinking about, I would encourage you to reach out to at least 4 or 5 therapists, believe it or not, when you are trying to connect with someone, because those are some really real barriers that people experience. And we want to reduce the amount of time you're waiting to get that kind of help. Scaling back your commitment. So maybe other people have already given you permission to do this, but you haven't yet given it to yourself. It is so important to really be honest with yourself about your commitment level and your spoons, right? The most important thing when we're talking about our short-term and long-term support choices is not that you pick something off of this list and do it. The most important thing as it relates to coping is that it is specific to you and it is something that you get respite from, relief and renewal. And it's going to look different for every person. So resilience is the ability to adapt to challenging life experiences such as setbacks, misfortunes, and adversity, while we are able to maintain our psychological well-being. So factors that might impact our resilience are our social supports, the quality of those supports, and our coping skills. So I'm wrapping up here shortly, but I want to just offer to you some suggestions as you move forward and notice your emotions here. I want you to avoid making comparisons to how or what other people are doing. I want to encourage you to try to make a connection to your physical body, especially because with cancer, sometimes we can really, feel like it's not the body we once had. It's different, and we have to find a way to get to know it better, to get to know this new body. If things like massage is allowed by your care team, light walking, paced breathing exercises, Reiki, all examples of how to connect to your physical body. We don't often think of coping with emotions as something we can practice, but please, I invite you to think of it as a muscle you can strengthen with intentional skills and exercises. A therapist might be your trainer, a support group would be your CrossFit buddies, and a peer mentor could be your accountability partner. And if you skip the gym one day, you don't just stop going altogether. You make a plan to wake up the next morning and try again. You always get to try again. This is the beauty of fresh starts. And that being said, you also get the chance to change your mind. So if something isn't helping you, I want you to try something new. Don't feel like you have to muscle your way through it because it has worked for someone else. So I just want to invite everyone in their chair right now, wherever you are, if it's comfortable for you to close your eyes, please do so. Set both feet on the floor if comfortable. Rest your hands in your lap and notice your breath. Notice just your breath exactly as it exists in your body. I'm going to suggest a few prompts here, and you can repeat them to yourself. And as you continue to just breathe normally, I just want you to hear these words and invite them in and maybe repeat them to yourself as well. May I be filled with loving kindness. May I be filled with loving kindness. May I be peaceful and at ease. May I be peaceful and at ease. May I be well. May I be well. May I be happy. May I be happy. So leaving you with these words today, letting them fill your cup. This is a brief loving kindness exercise. Mindfulness practices are a great resource to fill your cup with. I encourage you to do a dive if that felt like a meaningful practice to you. My last slide here are just a couple of links to some of my favorite things. Rutgers University has a wonderful DBT channel. DBT, again, stands for Dialectical Behavioral Therapy. I have a link there to the Spoon Theory, the book Man's Search for Meaning by Viktor Frankl. I'm not sure if you all will have access to these slides and these exact links, but I have them linked there. There's a wonderful meditation station on the OncoLink organization's website. And of course, please remember the helpline numbers for many cancer organizations like Cancer Care, Cancer Support Helpline, and the Kidney Cancer Association Navigator Program, of course. So thank you so much.